Hello, my name is Taylor Harden. My presentation is for HIM 2012. My presentation topic is ROI in Florida, Hospitals versus Physician's Office. Some questions that I will be answering during my presentation include: what is ROI? When was ROI introduced? Why is the release of information important to healthcare? How does ROI relate to the healthcare profession? Where does ROI fit into healthcare? And who does the ROI system impact or affect? So what is ROI? ROI stands for Release of Information. What does it mean for information to be released? In healthcare, it pertains to medical information being released by the physician. In Florida, the physician maintains the medical record. However, both federal and state laws say an individual has certain rights to access, use, and disclose his or her personal health information. In the state of Florida, there are laws that govern the access and release of patient information. Patients can request copies of their lab results, a copy of their medical record, or their billing record. When was ROI introduced? So in 1996, the HIPAA privacy rule was introduced, and with this came rules for the release of information. This rule was put into place in order to assure that individuals' health information was being properly protected, also while allowing health information to be released in order to provide and promote healthcare and to protect the public's health and well-being. The creation of the EHR added a need for the ROI rules. Why is the release of information important to healthcare? Medical information is vital to ensure the best patient care, and making sure the information is organized is important to ensure proper patient care. If a patient were to have some tests done and the results were not properly filed, this could lead to improper care. The patient could possibly end up receiving the wrong medication, or their records could be released to the wrong person. Privacy and confidentiality is expected to be upheld by physicians and medical staff. So having a system in place for them that is backed by law to ensure the proper release of information is important for the continuum of care. How does ROI relate to the healthcare profession? The release of information system is used by both physicians in private office as well as in hospitals. I've also found that many physicians are part of a medical group associated with a hospital. So it is a set of physicians' offices that are also attached to a hospital that are all part of one medical group. Where does the ROI fit into healthcare? In healthcare, the ROI system is used wherever medical information is used. Florida statutes allows patients or their legal representative to receive copies of all reports and records relating to an examination or treatment by a healthcare practitioner. The ROI system is used for billing, research, reporting, and patient care. Physicians' offices make use of the ROI system in order to release confidential medical information to a patient upon request. When it comes to billing, the patient's record is released to be coded and then billed to a patient and their insurance company. Medical information is also used for research as long as it is obtained in a way as to not harm the identity of an individual. Medical information is also reported in order to track cases of outbreaks of disease or STDs. Who does the ROI system impact or affect? Physicians in both hospitals and private practices are affected because they create and maintain the patient record that is being released. Those that are involved in billing, research, and reporting are affected as well. In the state of Florida, all hospitals and physicians' offices have their own system in order to release medical information. The North Florida Regional Medical Center here in Gainesville is an example of a hospital that has their own ROI system. North Florida Regional outsources their requests to a processing center in Orange Park, Florida called SCIOX. The patient goes to the hospital's patient portal and fills out a request form, and then sends the request form to SCIOX. The form is reviewed and the records requested are delivered within a week. Many physicians' offices, such as Primary Care Institute in Gainesville, have adopted the patient portal. And in the portal, patients have access to their records and any test or lab work that was done. Other physicians' offices, such as Primary Care Physicians of Gainesville, have a form on their website that is required to be filled out and sent to their doctor's office before any information can be released. In summary, the ROI system is meant to keep information secure and organized for both physicians and patients, as well as anyone involved in patient information, whether in a hospital or a physician's office. My hopes are that this presentation helped to establish a connection between ROI and healthcare in Florida, as well as how it pertains to both hospitals and physicians' offices. I hope that I made the who, what, when, where, and why, and how of ROI clear. These are my references, and this concludes my presentation.